The final topic that we're going to talk about this semester is posture, such as you see here, which you can improve by balancing stuff on your head sometimes. So posture is actually two discrete issues. First of all, there's maintaining the center of gravity over the base of support, which for human beings is usually either the feet if we're walking or standing, or the butt if we're sitting, but sometimes it can be other stuff like we see with this gymnast here. And the second thing is what your grandma used to yell about when you were slouching around the house, which is minimizing maladaptive moment arms. So here we see somebody with a big forward head and thoracic kyphosis. This is the center of mass of the head, and as you can see, the head and neck are creating a big external flexion moment on the thoracic spine. So first we're going to talk about the first aspect of posture, which is maintaining the center of gravity over the base of support. Compared to quadrupeds like a bear, and I have bear paws here next to the human feet, humans are relatively unstable. We have a high center of gravity, or a high center of mass, relative to our size, and a small base of support, certainly compared to quadrupeds. As we mature, our center of mass relative to the height of our body migrates downward. So here we see a baby, and for reasons that you perhaps have learned about in embryology, a baby's head is quite big relative to the rest of his body, and that is one of the reasons that babies have a very high center of mass, which is also one of the reasons that babies are especially likely to topple over as we mature. So here's a girl of about 8 years old, and you see that her center of mass is about at the thoracolumbar area, and here is a yoga practitioner with beautiful posture, and you see her center of mass is at about the L4-5 area. Our gentleman scientist here is interested in why the foot of an arboreal ape is different than the foot of a terrestrial ape. So we, human beings, are mainly terrestrial apes. We're one of 5 of the great apes, human beings and gorillas and chimpanzees and bonobos and orangutans. So here we see the foot of a chimpanzee compared to a human foot. And you see that relative to a chimpanzee, a human has long metatarsals and short toes. A chimpanzee has toes that really resemble fingers. Now, the reason that this would not be adaptive for us is mainly what we use our feet for, rather than interacting with the trees, is interacting with the ground. There was a study published in the Journal of Experimental Biology in 2009 that showed that if our toes were long, like for instance a chimpanzee, how much greater the energy demand would be on the long toe flexors, because we would have to manage so much more of an external dorsiflexion moment when we would walk or run. So instead of having long toes and short metatarsals like the chimpanzees, we have relatively short toes and long metatarsals, which allows us to use our feet interacting with the ground with way less energy demand. Now, we have, as human beings, 3 sources of input about what is horizontal and what is vertical, and that is what allows us to remain upright. Here's our yoga practitioner again, and she can see what is vertical and what is horizontal with her vision. That's about 1/3 of all of the input regarding those factors. There is also, you may have heard of this, the vestibular sense. The vestibular organs are organs within the inner ear that give us information about the position and the acceleration of the head in space. And then there's tactile input coming from the supporting surface, our feet if we're standing, walking, running, etc., or our butt if we're sitting, or whatever is in contact with the supporting surface. That lets us know what horizontal or relatively horizontal is. So how do we remain upright, which is something that this baboon is quite skilled at, considering that she was really not designed to be in this posture very much. Back in the 80s, when I was a physical therapist student, we considered these support synergies, they were called. And one is called the ankle synergy, or the ankle strategy. And for example, if something were to perturb us from the rear, then the ankle plantar flexors would push back like a torsional spring and help us to remain upright. And we believe that this movement came primarily from the ankle. And also was a hip synergy. So again, if something were to perturb us from the rear, we could move our hips backward and therefore maintain our center of gravity over our base of support. Or if something were to perturb us from the front, the same sort of thing except in the opposite direction. We could extend our hips, bring our pelvis forward, still maintaining our center of mass over our base of support. And then finally, there is the change in support strategy. So for instance, if you have been in a big airport, which I think everybody has been, and you step onto those trams to take you from the terminal that you landed to the gate where your baggage is, those trams will start rather suddenly, and you may need to step, or you may need to grab onto something to keep from falling over. Those are called the change in support strategies. More currently, however, we take a more nuanced approach in describing our strategies for remaining upright, such as this gymnast has just failed at. We describe them as fixed and non-fixed. So fixed means that your feet, if you're standing, remain in the same place, and non-fixed means that you have to either move your feet or depend upon something else to keep you upright. And the reason for that is that one could not sway at the ankles without using the hip musculature, and conversely, one could not flex or extend at the hips without the ankles also moving. We need to be able to stabilize our head because we want to stabilize our field of vision. And we're actually really good at this and have a lot of circuitry that helps us achieve this. That is integrating the visual system with the vestibular system. An exercise that I'd invite you to try is to pause the video and walk down a hall while looking at something small at the end of the hall, like a doorknob. And you'll find that you're able to actually stabilize your gaze quite well, even though your head is actually oscillating up and down as you walk. The reason that we're able to do this is because of considerable integration between the visual system and the vestibular system, which is something that you'll learn about in the next semester with neuroscience. One of the things that you may not have considered about our ability to remain upright are all the abilities that we need to master in order to be proficient at it. So we need to learn what external forces mean. For instance, we need to understand what gravity means relative to our ability to stay upright and how the line of gravity is perceived as center of foot pressure. As we are born and carried around by our mom or dad or some other person as very small infants, we come in contact with inertia. And you may have seen newborn babies are unable to keep their head upright when they're being carried around, but as they mature, they both develop anti-inertial strength because they are not strong enough in the axial neck muscles to have anti-gravity strength yet. But the first thing that they develop is anti-inertial strength, and they learn that if their mother or whomever is carrying them is going to the left, that they need to engage the axial neck muscles on the right side. We also learn what ground reaction forces mean relative to staying upright, and that we need to counteract those ground reaction forces with internal forces, such as we see at with the yoga practitioner in the illustration on the right. This is really a similar kind of problem to the problem we considered early in the semester when thinking about static equilibrium equation. Now, no animal, when it is awake, is actually absolutely still. We all have some postural sway, which you can check out in just standing, especially if you're standing on one foot. And that is what the final lab or the final kinesthetic learning experience that we're going to do is going to be about. So the magnitude of the sway is dependent upon neuromuscular factors. People with neuromuscular problems, such as Parkinsonism, have more difficulty and have a greater sway than people who do not. In sensory input, again, this is one of the things that we're going to check with that kinesthetic learning experience. If we close our eyes, it's way more difficult to stay upright because the amount of sway increases. Also, cognitive load increases the amount of sway. Now, most of you are very young and healthy and will have no problem with staying upright. But with people whose ability to stay upright is impaired, if you ask them to do math problems while they're attempting to stand, that will actually encourage them to fall over because they don't have enough brain power really to do both. Now, I had a professor in my PhD work at the University of Minnesota named Tom Stoffrigan, who wrote many papers saying that postural sway may be adaptive. He argued that postural sway is one of the ways that our body is always gathering information about our own inertial characteristics of our body relative to the environment around it. Luckily for us, we don't need to use a ton of muscles just to remain upright. I think we've talked about this before. And you've thought about this with the muscles of the trunk and neck, like what are stabilizers and what are more the moving muscles. So the stabilizers are active really most of the time. And the reason they can be is because they're small and they're not generating a ton of joint compressive force or having a ton of energy demand. So if we are upright, and we're just going to think about the lower extremity right now, here is the center of mass, and there's a line of gravity. So rather than the hip muscles having to hold us upright, the line of gravity is passing behind the sagittal plane axis of the hip joint. Therefore, the hip is held upright by the tension on the iliofemoral ligaments, really. The knee is fully extended, and you will learn a lot in musculoskeletal and a little bit more in kinesiology about the idea between closed-packed and open-packed positions. Closed-packed and open-packed really depends upon the joint. You know, in some joints there's not a big difference between their closed-packed and open-packed position, but in the knee there really, really is. And so when the knee is fully extended, like it is here, then the knee is held upright by the tautness of 3 of the 4 ligaments, the ACL, the MCL, and the LCL, and the congruency of the joint surface. So we do not need quadriceps or any other knee muscles to remain upright. And then relative to the ankle muscles, the ankle plantar flexors actually have to work to keep us upright because you see that the line of gravity is passing in front of the ankle joint axis and therefore producing a bit of a external dorsiflexion moment. Luckily, the ankle muscles are very good at generating the torque that we need to keep us. So let's talk in a bit more detail about all the input and output that needs to be wired together in order for us to navigate in a world where gravity exists. So especially if you're interested in pediatrics, you may have heard the expression sensory integration, like a clumsy kid has a problem with sensory integration. It is an expression that is way overused and used to mean things that are really not a sensory integration problem. However, there are sensory integration problems, and what it means is that your senses need to reflect reality. So if you are running, for instance, down the road like the young woman in the picture, your head is oscillating up and down. And so the input that is coming from your visual, vestibular, and kinesthetic sense all need to agree. When either foot makes contact with the ground, and then the joints of the lower extremity flex in order to absorb the force of the foot contact, then a runner will be on the bottom of the oscillation. So their vestibular organs need to reflect that they have just finished the acceleration downward. Their vision also has to reflect that they've finished that acceleration downward and that they've integrated perhaps 8 or 10 centimeters. If it is different, or if your vision is telling you that you're oscillating upward while your vestibular sense is telling you that you're oscillating downward, then that really is an impairment in sensory integration. So let's go ahead and think about this integration with a rather complex task of running the hurdles. So here we see an athlete, and in order to successfully run the hurdles, she needs input from her visual system, which includes the proximity of the obstacles and the destination, so she knows where these hurdles are in space, and the amount of vertical displacement of the eyes to give her some input, not all the input that she needs, but some input about whether or not she is reaching sufficient height to clear the obstacle. And also about lateral stability to make sure that she's not going to fall over to the side while she is in the air. And also velocity through the field of movement. As she gets closer to the destination or an obstacle, both those things will get bigger in her field of vision. Also, there's what's called the lateral flow of vision. So in her peripheral vision, she can see the other runners and see especially the spectators and the setting of the track in order to know where she is and how fast she's going. We described the vestibular sense before. So the athlete needs to have input regarding the vertical and horizontal acceleration. Remember, the vestibular sense are exclusively in the head, so that's the sensation. She's also getting information regarding frontal and sagittal and transverse plane acceleration of the head, but luckily for us, it is wired to the visual system and to some extent the motor system as well. So in order to do this task of running the hurdles successfully, she has had to have practiced and learned the skill. However, hurdling is going to change from environment to environment, and also you've probably experienced, and some of you are rather fitness conscious and exercise, that some days you seem very strong or fit, and then a couple days later you're really having trouble with these things. So, for some reason our muscles produce a little bit of a different output from day to day, so we need to adjust to that. Now, specifically in this case, look at the vertical distance between the lead leg and the obstacle, which is really just a few centimeters. And note the vertical distance between the trailing leg and the obstacle. So if she does not flex abduct that trailing leg, she's going to smack the hurdle with her left thigh in this case, or her left knee. However, she's able to lift in time in order to do this, and that comes from practice. However, as I was saying before, the circumstances and the conditions will vary from race to race, so she needs to adjust the muscular output in order to do that successfully at every practice and every competition. And in order to do that, we need visual integration of the visual and vestibular information over the overlearned motor program, which she has learned in order to do this task. When recording a PowerPoint like this, PowerPoint seems not to be able to open hyperlinks, so I will just link this particular video to the course Blackboard site so that you're able to see the complexity of the motion and how the athletes especially lower their center of mass while they're going over the hurdles in order to minimize the vertical excursion of the center of mass and therefore do it as fast as possible.